There you go. So my name is Pat Broderick. I'm chair of emergency medicine at Danbury Hospital, New Fairfield resident. I've been practicing emergency medicine for 26 years. So needless to say, yeah, I've seen a lot of different things over 26 years. My emergency department is a safety net for society, for when everybody else turns their back. We have busted our hump over the last number of years to control our costs, to make sure we have efficient staffing, to do everything that we can to make sure that we have bodies there in the department when people are hurt and sick, injured, et cetera, et cetera. This proposed healthcare spending reduction is going to kill us. I mean, there's no way that it's not going to affect jobs. It's no way that it's not going to affect people's ability to have access to care. So I guess really the question is, we understand that there's a lot of proposed spending cuts. What is state government doing to control its costs? What are they doing? This gentleman talked about freezing the expenditure. What are they doing to control the cost? What are they doing to negotiate with the unions to help give some concessions? What are they doing to make sure that the services they're providing, mental health services, are being run efficiently? Why don't we've outsourced a couple of services at the hospital because we realized we couldn't do that the most efficient way. There are people that can do things more efficiently. I don't see any of that kind of stuff happening at the state level. Businesses, hospital, health, we're all doing that to try and reduce our costs. There's no more dollars coming in. We're getting stung from the feds to third-party payers. Everybody's negotiating down the dollars coming into healthcare. Meanwhile, the sick people keep coming in. There are more and more people coming on Medicare every year. We want to be able to take care of these folks, but this whole thing is just crushing us with these spending cuts. So if you could just maybe talk a little bit about who's holding the governor accountable for the efficiencies in the spending component of that. Thank you very much.
Thank you. The short answer is nobody's holding it. And it's one of the reasons why for many years I've unsuccessfully lobbied for an inspector general office. We're a part-time legislature. You don't want us to be a full-time legislature because if you think they pass a lot of bad laws now, imagine if they were in full-time, right? And there's no oversight over the executive branch and the different agencies as to how to spend their money. I used to reference one time, Mike does a great job in the Transportation Committee. I was once on the Transportation Committee, and I joked once that we spent more time debating whether we should go from the blue and white license plate to the new reflector license plate than we actually did questioning the commissioner on his budget and where the money's being spent. So the federal government has Inspector General, which has subpoena power, accounting oversight, investigatory power. They go into every single agency of the federal government and they root out waste, fraud, and abuse. We should have that at the state level. I'll just give you one really quick story, true story. Small business owner was up at the Capitol. He had a contract with the state of Connecticut. He actually had 2 contracts with the state of Connecticut. And what he said was the state was paying him different rates under the 2 contracts, even though they were both negotiated within about a 24-month period. So one agency was paying more for his product. He was selling shirts and soap screening shirts. And he told me about the contract he had with the Department of Corrections, the shirts that our correction officers wear. And the Corrections Department, through the state, ordered special shirts, not off-the-rack shirts. And when I asked him why and how much, and I forget how much, but the off-the-rack shirts cost a lot less than the special order. He told me that the off-the-rack shirts, which were dark blue, had brown buttons, and the Department of Corrections wanted blue buttons to go in the blue shirt. Now, you can't make this stuff up. Those decisions are being made in state government all the time. About a week ago, Larry Cafaro, a good friend of ours, the minority leader in the House, discovered that we have a program for state employees that they never developed, and it cost us $2.1 million for them not taking a program that we didn't develop. So there is so much waste in the tens, if not hundreds of millions of dollars. But, and the first gentleman talked about freezing spending, and we've offered budgets that have frozen spending. But I would submit to you that unless we fundamentally transform how we spend our money, we're fighting against a tide that we can't stop. And that red line on the first slide proves the point. So what should we do? We're a dual delivery state. Remember that slide of where our money goes? 22% goes to social services. So the state has hospitals that it owns for the mentally ill and other things. Riverview Hospital, a state-owned and run hospital for severely mentally ill kids who need care. They need daily care and supervision. It costs us $1 million per child per day. In a similar private hospital, it costs them about $450,000 to $500,000. There's anywhere between 75 and 100 kids on an annual basis at Riverview. 100 kids times $500,000 savings per year, you've saved $50 million. You haven't cut their care, you've just delivered it in a different model. So we should get out of the business completely of social services delivery, fully fund our nonprofit social service organizations, save some of the savings that we have, and we will save, once we do it, we could probably save between $350 and $500 million annually. The real number is probably closer to $500 million, and you can take some of those savings, okay, use it for oversight and accountability. You can take some of those savings and actually give the social service providers more money than they're getting so they can care for more people, and you still can reduce the budget. You haven't cut anyone's care, you haven't thrown anyone out in the street, you've delivered it in a different model. The state cannot do things like that at the same cost as our nonprofits can. We know it for a fact. That to me is the single biggest thing we need to do. You know, how many people have gotten their driver's license at AAA recently instead of going to the DMV? Was it easy? Did it work? There are so many things we can do that in state government to save money. We need to do it.
Thank you, Doctor. Certainly you raise a point that some of us outside of government probably take for granted. And those of you that have been around local government realize that you have to deal with a balanced budget in local government. So chief elected officials like Mayor Mark Bowden and Pat Boger in Newtown and John Hodge in New Fairfield, they are running their government a little differently than state government runs, and here's why. State government has an agreement with state employees that guarantees no layoffs, and you can't touch the pension fund and benefits plan until 2022. So that's the deals that were made when they extended the contract. And then the other problem is that when budgeting is calculated, they first fill the buckets where the state employees are, and then whatever's left over, they fill the buckets for hospitals, nonprofit organizations that have contracts with the state, and they operate those contracts at 32% discount on what it costs the state to do the same thing. So that's the problem, is the priority has to fill the buckets for the existing number of state employees first. And then whatever's left over, we can go take care of other things. That doesn't happen in local government, and obviously it doesn't happen in the private sector either. And that makes budgeting in state government a big challenge. We start in the hole trying to deliver the same number of services, but most importantly, we can't do the best practice business decisions that you've done at Danbury Hospital and that are happening all over the country, and that are even happening in local public schools. Local public schools are doing things like you've described. That's government funded, but we can't do those things in state government, so it's a challenge right now.
Doctor, good to see you. I just want for the records, New Fairfield 2, the rest of the town 0 at this point, so it's good to have New Fairfield. just keeping it light here, but you know, holding the government accountable, and Senator McLaughlin talked a little bit about the deal that was put together by the governor and the unions. And one thing that has been mentioned, seems to be forgotten about, part of the deal was the union was supposed to save $1.6 billion in various concessions or redoing the way they did their jobs, but to come up with this savings plan. Well, guess what happened? They didn't quite do it. In fact, if they even got to half of that, that's being optimistic. So there's deals that are being made that just, you know, they're kind of just soft deals, phony deals, if you want to call it, make it sound good, but it never actually happened. In my mind, the only way to hold government accountable is when you go into the booth. So if you like what you're hearing here tonight, or what you've seen up there, or if you don't like what you see up there, and you want to make a change, that's how you hold us accountable.
The other thing we could do, the last thing on that, is we could actually vote on those contracts, but we don't. We don't vote on any of the state employee contracts. They actually negotiated by the governor, and if they sit on our calendar and don't get called for a vote, after 30 days, they're deemed approved. And when Governor Malloy first spoke to the legislature after being sworn in, I remember he said, "This is not right. You guys need to vote on these contracts. I want you to be accountable for these contracts too." The Republican side of the House stood up and clapped. Well, the first contract we had was his negotiated deal with CVAC, and we didn't vote on it. So a lot of times you go to these types of forums and you hear legislators say, and I think Mike more correctly pointed out, but they'll say, we can't even touch a big percent of the budget because it's tied up in contracts. They approve the contracts. So there's a lot of not being held accountable.